Hi there, welcome to another one of my videos. This one is all about what we mean by learning objectives versus learning outcomes, and going to help you if you're new to the medical school, or if you're on the second year of the program, or if you're in another year and you just want a kind of reminder of a couple of things. This will be useful, I hope, for case-based learning and a few other things as well to get the most out of these sessions. So let's start with a little definition. So learning outcomes and learning objectives, or LOs, are terms which are going to be found a lot within the early years curriculum. And over the last year or two, as a faculty, we've tried to make more of an effort to try to direct students to engage with learning outcomes and objectives in sessions. But these are terms that you might come across and think, well, they're the same thing, or sometimes they might be used interchangeably, and they're not exactly the same thing. So let's just go quickly through what we mean by these things and how they differ. So for case-based learning or your CBL sessions, what you're going to find is that those sessions have learning outcomes attached to them. And these are also found in your LSRC sessions and also in your lectures, which we sometimes call plenaries as well, the same thing. A learning outcome is something that you're working toward. A learning outcome may not be entirely covered in a specific session. It's going to take time to achieve understanding or mastery of. Don't expect to walk into a session and leave it with all the learning outcomes covered, everything makes sense. It's going to require you to approach that learning outcome from different directions. STL, engaging with resources, case-based learning, engaging in your lectures and LSRT session. And by approaching it in different angles, over time, you're going to achieve learning around that LO, that learning outcome. It will take time though. A learning objective is something that you may come across more with clinical skills. So the idea is that in a specific session, the objective is that you will leave that session being able to do something. So for example, here, by the end of a session, you should be able to perform a hand wash using a particular technique. So that's something that you attend your session, you learn how to do, and by the end of the session, you should be able to do it. Now, that's not to say that that's the end of the story. Of course, you need to be going back over these things and revisiting and revising them. But they're two subtly different things. Sometimes you may just hear the abbreviation LO. They're not exactly the same thing. A learning outcome is something you're working toward over time. A learning objective is probably something you're learning to do in a session, but that might require a little bit of time or practice after the session as well. When you move to university, and particularly when you're thinking about medical school, one of the challenges is that you're moving away from curricula that are really highly curated. So what I mean by that is that at A level, you may have had a teacher saying to you, learn about photosynthesis, but not immunology, learn about this organ, but not that one. And that's all governed by the exam board that you did your A level with. And I'm sure this is true of other exams you may have come into medical school with. But at medical school, the challenge now is that you're engaging with topics where, to be honest, everything is important. And one of the challenges is that you need to know a little bit about a huge range of different things, sometimes whether they're of interest or not, or whether you sometimes see the relevance or not. And certainly all of these things are entire degrees in their own right. And so where the learning outcome comes into it is that it helps you give that scaffold and that backbone, understand what is it am I supposed to be learning? The level of detail you go into is also another difficult one. How much am I supposed to learn? And I would always say, as a good rule of thumb, use your LSRC sessions and your lectures and your workshops to help you gauge the level of detail whilst acknowledging that we're not going to cover everything in that session. Use your other resources to link to build upon your learning, and use case-based learning and your study groups to see how your learning compares with other people. So what am I supposed to know, what to learn and what to do? Again, so this is where attending your sessions, talking to your lecturers, remember, we're here to help you, talk to each other and use the sessions to sort of calibrate what you're supposed to be going into is a really useful starting point. You'll see that attached to every learning session are learning outcomes. So this is just a screen grab from a physiology session on the DLE. So you'll see there'll be a synopsis that will just give you a quick overview of what the session is. The learning outcomes will be all listed. Some of these will be duplicated with CBL. That's deliberate. Remember, what we're trying to do with CBL is better link your teaching through to those case-based discussions. Previously with EBL, you would have set a whole range of questions, which would have been in addition to all these other learning. We want to try to make your learning really efficient and try to steer it a little bit better than we have done in the past. And you'll see, if you look at all the words, they're all active things. It's describe, explain, recognize. There might be other things like list, draw, name. These are all things that you can do in a study group. So again, we've tried to choose those for CBL to be really good or better LOs to cover within a small group setting. It's really important early on to just remember that what we're trying to do is not just build up your knowledge, but it's also about developing your understanding as well. So just being able to memorize an equation is to some degree quite easy, but to actually be able to apply that to a setting, to a person, to understand and explain it to another person, is a slightly higher level of order of thinking. That is kind of what we're after a medical student. And if I can give a piece of advice, certainly for case-based learning early on, is to try to reflect that in the questions you're asking. So when we're thinking about, for example, imaging, and the first case in year one deals with someone with a twisted ankle, maybe ask questions which aren't super specific and things like, what does a broken ankle look like under an X-ray? But think and keep it broad. Think about imaging more generally. What's the difference between MRI, CT, and X-ray? And why would you use one and the other in a particular given situation? So focus on your understanding, and you can do that by explaining stuff to other people. This is a piece of advice which I tend to give APs, and it's a simple one. It's called the Feynman technique. It's named after Richard Feynman, who is accredited as the kind of the developer of it, I suppose you could call it. And his idea was quite simple. You take a concept, in this case, it might be a learning outcome, and then see if you can teach it to yourself or somebody else. But don't overcomplicate it. Imagine you're explaining this to a novice. If you can take that quite complex LO and explain it in a way that's really simple, it helps you identify the gaps in that knowledge. If you're really struggling to do it, picturing your friend or your group as a 5-year-old, if you're really struggling to do that, but it indicates to yourself that maybe you don't know it quite so well yourself, and then you can go back and do some more independent study and then try again. And it's about this idea that within medical education, it's very easy to overcomplicate stuff. Early on, if you can take a very complex biochemical or genetic or molecular biology or psychological principle and really simplify it down to a level that a child can understand it, it goes some way, firstly, at building your confidence in that area, but also gives you an indication that you do understand it in such a way that you can explain it to another person. So whether this is a technique you've heard about or not, I'd recommend looking into it and then seeing if this fits and works for you in your own FDL. So a question that comes up quite a lot is simply, will my teaching sessions cover everything? And, will I essentially, all I have to do is attend the sessions and all the learning outcomes are covered? And unfortunately, the answer to that is no. When you attend your teaching sessions, you're going to, let's say, imagine you attend a lecture. Your lecturer will cover a range of different things in that session, but it will require you to take notes on areas of sort of uncertainty, follow-on questions that you have. Try not in lectures just to write the script of what someone's saying. It's much better to identify concept that someone's coming up with and then some follow-on questions for your own study. And you're going to probably go do your independent study in a range of different things. Some of it will be on your own, in a room or in the library. I'd recommend finding a study group to work with, because that's a really helpful place to kind of work with other people. The ability to explain stuff to other people is really useful, as well as using these things in case-based learning. So your learning outcomes that are introduced to you are likely to require you to do learning in all of these things, as well as engaging with resources like osmosis or other things you find on loan, so zeros to finals, BMJ best practice, all the e-learning books you do, BNF, other sources of information as well. And these will help you grapple with these learning outcomes. It will take time, but over time, that base knowledge builds up, your confidence builds up as you start to really get your head around things. And when you revisit these LOs over time, you spend less and less time on them because it just becomes more and more kind of like subconscious or tacit information that you really truly understand. So no, the short answer is we can't cover everything in individual teaching sessions because, to be honest, we have limited time within that contact session. So some teaching sessions will have several learning outcomes, and we may choose to cover all of them in a bit of detail over the course of that session. Whereas other sessions will say, I'm going to focus on 2 or 3 LOs because these are the hardest ones to grapple with, and I'm going to leave a couple more for your independent study out of the session. Remember that the LOs will be shared between sessions, and that's quite normal. And it is unusual to not have necessarily a curriculum that's super highly defined for you. We are there to help you. And if you're not sure, you'll have an academic tutor who can help understand or get the most out of these LOs. As reassuring, all of these LOs are mapped ultimately through to the MLA, and the prep for that exam starts from year one. Everything that we're doing in the first couple of years is about building up base knowledge to help you understand those fundamental sciences. And then when you move through to the clinical areas of the program, you're going in confident that you've got a really good understanding of the fundamentals that you can apply in those environments. But everything that we're doing has been mapped through to the MLA, and also things have been mapped through often to various Royal Colleges and Learned Society curricula as well. So going back to that physiology LSRC session, you'll see that it's been mapped to the Physiology Society. So this isn't something that we've flung together. It's all part of a much bigger plan of making sure that what we're doing maps to various national and international guidelines so that we can be confident saying to you, we are preparing you to be some of the best prepared graduates in the country. I finish with just a few tips, and these are sort of some repetition of some of the things I've already said. But if you're not sure, feel free to get in contact or speak to your academic tutor. Remember that although textbooks exist, there isn't a nice resource that covers everything. You will probably need to do learning from a range of different sources, ebook, videos, helping each other, lectures. They're all completely valid sources of information. When you're learning a topic, try not to think about memorization of a PowerPoint slide as being everything that you need to do. Your sessions are just the starting point. We're asking you to go away and do additional reading around that as well. And try to use a study group to help. Explain, describe. Your CBL sessions will help. I'd encourage you to get involved in panels this year as well. And you can get together with flatmates or other friends you meet over the course as well to help you out. You may choose to do stuff independently. You can still use some of these techniques on your own independent study as well. Remember that we can't cover everything in 45 minutes. So there is going to be an element of you doing additional reading. And just appreciate when you come to university, all universities, you are reading for a degree. So that independent study is absolutely essential. But this is where CBL will help. And please remember, as teaching staff, we are here to support your learning. If you're not sure, if you're stuck, get in contact with a session provider, get in contact with your AT, or just come upstairs, knock on the door, and we're happy to have a chat. If there are any questions that follow on to this, you're very welcome to get in contact, and I'll see you soon.